Thank you, Mr. Chairman. And Secretary Shinseki, thanks for being here. Thanks for the meeting in your office recently with Senator Collins and Senator Murkowski. I thought it was very helpful, and I appreciate you taking time to do that, as well as your commitment to our veterans, your service and your commitment to our veterans. Also, I appreciate very much that you've come out to the VA Health Center in Fargo, which serves a lot of North Dakota and Minnesota as well, and I think does a phenomenal job. One of the things that's been really important for us is getting another outpatient clinic in Devil's Lake, North Dakota, and I've talked to you about this before, and I believe as a follow-up, your staff indicated to me that they're planning to have a lease in place for that facility in August of this year and then have it open by December. I want your commitment that we're going to get it open this year. We've been working to get that for some time, and maybe just comment on the length of time it takes, because last year we talked about getting it, which again we appreciate very much, and that they're very much looking forward to in Devil's Lake. But just your comments on the length of time or what's required to set it up, and hopefully a commitment that we'll have it in place this year.
Let me call on Dr. Petzel for the opening.
Thank you, Mr. Secretary. Senator Hoeven, we've been talking about the clinic in Devil's Lake since I was a network director in Minneapolis, which goes back a couple of years. And there have been difficulties in coming to an agreement about the kind of clinic, et cetera. That's on track now, and we expect to make an award for space in August of 2013, and the planned occupancy is December of 2013. I will keep track of that, and we will feed back to your staff periodically about how we're doing with that timeline.
Thank you. I appreciate it. We're very much looking forward to that facility. It'll make a real difference for our veterans, and so if you'd stay in touch with us on it, I'd appreciate it very much. The other thing, Mr. Secretary, I'd like to just touch on again, two of the things that we've been working on, I know you're very dedicated to as well, on behalf of our veterans, are both suicide prevention and also dealing with PTSD. Would you talk about how in this budget we're doing more to make sure that we're addressing these very serious challenges on behalf of our veterans, both the suicide prevention and addressing their needs in regard to PTSD?
Senator, let me start, and then let me ask the good Dr. Petzel to comment on our approach to suicides. I would just say up front, one suicide is a tragedy, and it's one suicide too many. And so we go at this with a lot of energy, and as you know, we have put in place a national crisis line for veterans in Canandaigua, New York. It in the last five or so years, over 740,000 phone calls. I think important in that number is that 26 of them were suicides in progress that were intervened and people were taken care of. We've watched the numbers of calls continue to go up. The number of crisis calls have begun to taper off a bit, and what we interpret here is that calls are coming earlier as opposed to in crisis. People are being referred to treatment. Treatment they're receiving works, and we're watching our suicide numbers, which are still high at 22, a rate of 22 a day, staying flat and not necessarily spiking as we have seen elsewhere. So we believe we have a good set of treatments and the opportunity to medicate folks properly. Let me call on Dr. Petzel.
Thank you, Mr. Secretary. Again, Senator Hoeven. Suicide is a national tragedy, and suicide amongst veterans, I think, is even a deeper tragedy. This and PTSD, depression are the results of their service experience and are sort of the unseen wounds of war. And I think we have a tremendous obligation in the VA to find ways to deal effectively with these things. Just briefly, our mental health budget is $7 billion. We're going to be spending almost $500 million more this year in 14 rather than we have spent this last year. In terms of PTSD, there are about 500,000 veterans with that diagnosis. 119,000 of them come out of this present conflict, and we'll be devoting, again, about $500 million to those people, and those veterans, and their treatment. We, in addition to that, have a research budget of almost $49 million in PTSD research within VA itself, and then a cooperative effort with DOD that takes $50 million from the VA and $50 million from DOD over a period of 5 years, and combines into 2 research projects on PTSD and post-traumatic and TBI, traumatic brain injury. Just a few words about suicide. The VA has a highly integrated approach to suicide, and we're fortunate in that we have this national system and allows us to do this level of integration that you can't necessarily do in other venues. For veterans, we have the crisis hotline, and as the Secretary mentioned, it has been very effective. Almost 800,000 calls, 26,000 rescues, people prevented from harming themselves who were in danger of harming themselves. We have suicide prevention coordinators at every single one of our medical centers, and a team of both outreach and case management mental health professionals for people that are deemed to be at high risk for suicide. And then we have a public service campaign that we're involved in combination with the Department of Defense to, pardon the expression, but destigmatize suicide, destigmatize mental health. It's called Make the Connection, and it's vignettes by people who have suffered from mental illness or who have attempted suicide, urging people to make the connection with the VA, telling them that this is not something that they should view with trepidation, et cetera. Been a very effective campaign, and I think it's responsible for the fact that we've seen about an 88,000 veteran increase in the number of people we're treating for mental health.
Doctor, thank you. And Secretary, this absolutely has to be an area of emphasis, along with your emphasis on homelessness. I encourage you to involve the veterans groups. I think they're tremendous, can be a big help for you in this area. And of course, share my concern on the disabilities claims. And I know you're working on that very diligently and know how important it is. Yeah. But this area of suicide prevention, PTSD, as well as the homelessness, has to be an area of emphasis. And hopefully you'll reach out to the veterans groups and get them to help too. I think it's a tremendous network that can be very helpful.
We will do that, Senator. And just to underscore how important we think it is, I think Dr. Petzel said very quickly that in mental health this year, our budget is over $7 billion for mental health alone. If we were to look back to 2009 to the 2014 time frame, our investments in mental health have gone up nearly 57%. So this is an area of importance to us, and we will continue to do that.
Thank you.
Senator.